Well, I mean, I think it's fabulous. My only worry is that are the young people who come in to the program. I'm particularly interested in MD physician scientists because I do strongly believe that an understanding of integrated biology is immensely helpful. And the urge to understand in an integrated way and to take your structural biology and your DNA information and your cell-based information, but always to try to visualize what it means in a more whole organism. And so I think it's important to have physician scientists as investigators in the system who see patients and whose research is influenced by it, because you may embark in an area of research that may not occur to somebody who doesn't have a clinical life. I don't think anybody would have worked on SRSA or cystinoleukotryens with the passion that I did if they didn't think it had something to do with asthma. You know, and for 20 years I didn't know the nature of the product I was working with. So that does matter to me, is to keep a cadre of knowledgeable physician scientists in the system, and that's getting harder and harder because as the NIH reduces its funding per se, and if you are going to maintain a clinical life and be competent in both basic science and in clinical medicine and be reasonable, meet your responsibilities as a family person, it becomes very difficult. And so I worry about whether or not we can sustain that group and whether I can keep these young people committed to this life. So far, we have been able to do that, but they're immensely talented. And they keep their eye on the human disease at the fundamental level, which I think is very helpful to asking the right questions.